All right. Well, good morning, everybody. It's Wednesday morning, and we're going to do some coffee talk. I hope you have a cup of coffee or tea or something. The topic today is the opioid response training. And so we've taken the basics of how to respond to someone in an opioid crisis from the mental health first aid curriculum. So if you've taken mental health first aid in the past, it was not included. Typically, most of our trainings within the past year and a half have had it, but before that, they didn't have this opioid module embedded. And in exciting news, mental health first aid is being revamped, and slowly they're getting ready to roll that out. And so future trainings should have all of this already embedded in it. But if you're just looking for some information on how to respond to someone who potentially might be having an opioid overdose, that is what we're going to focus on today. So, last week, there was a snafu with the streaming, and so the Know the Signs training was recorded, and I'll send that out to everyone who is registered, and it'll also be available on our YouTube channel. And then next week, I've got a scheduling conflict, so we're going to have to bump up the implementing mental health in schools and MTSS process. We're going to have to bump that up by an hour. So looking forward to that, and then in July, we're going to shift from Wednesday mornings. And we'll have additional topics to be chatting about. So let's get started. Our mission, the Speedy Foundation, is to advocate to prevent suicide, to promote conversations to end stigma, and to support mental health education. Everything we do is to advocate, to conversate, and to educate. We were formed in 2011 in memory of Jarrett Speedy Peterson, an Olympic freestyle aerialist, whose life was characterized by his service to others. He was my cousin. Our family established the Speedy Foundation in his memory. If it were to happen today, we probably would just start, a GoFundMe and donate or raise a large sum of money and donate it somewhere. But at the time, organizations like ours were hard to find, and suicide prevention efforts in Idaho and Utah were scarce. So as far as conversations go, we have helped launch Idaho's, Idaho's Suicide Prevention Hotline Call Center. In 2011, Idaho was one of the only states that did not have a local call center. Those calls were rolling over to other states, and that was a big service that Idaho needed. There was a plan that was already in place. All that Idaho needed was a story and a cause to help champion this work. They also needed a funding mechanism until enough funds were raised to launch. And so we helped the fundraising efforts and then handed it all over to Mountain States Group, which is now Janice, and they run the hotline. And we just try to help support it in any way that we can. We try to get everyone to program phone numbers into their phone. So while you're looking at this slide, you can pull out your phone, and I'm going to tell you a little bit more about these. When you call that 208 number, it's going to link you to the Idaho call center. If you call 1-800-273-TALK, that's going to link you to your local call center that's connected to your area code. So right now I'm in California, and I have a 208 number. So if I were to call the 1-800 number, it's going to link me to the Idaho call center. If I press 1, it'll connect me to the Veterans Crisis Line at that number, where I will be able to speak with someone who is trained to respond to veterans and everything that goes along with being a veteran. The crisis text line is separate, so program 741-741 also into your phone. Some people just want to be texting, some people want to be talking, and that's why we've got plenty to go around. The National Suicide Prevention Lifeline also has a chat feature on their website. So if texting and typing is what you're looking for, please go there. Also, just note, you don't have to be in a suicidal crisis to call that number. It is for anyone who needs to talk, anybody who's in a crisis, or if you're concerned about someone. Maybe you've got some signs, you've taken Know the Signs, you know what some of the signs are, you're concerned, you want to start a conversation, but you need to talk to someone about how to do that. Call the hotline. Other conversations, we set up booths, we've done storytelling, we do presentations, we're doing coffee talk, we've hosted film screenings, community panel discussions, and we hosted the Western States Conference on Suicide for 2 years to bring local experts into our rural states. As far as advocacy goes, we're part of a number of coalitions and collaboration is really key to advocacy. 2011 and 12, we worked on the funding mechanism for the hotline. 15 to 16, funding for the Suicide Prevention Coalition. Founding of the Suicide Prevention Coalition to get funding for the Suicide Prevention Hotline. And it also helped develop the Suicide Prevention Program in the Department of Health and Welfare. In 2018, we passed some legislation, House Bill 634, which is termed the Jason Flatt Act. So that was elevating suicide prevention education in Idaho. And again, collaboration is key when it comes to any of this work. We are on the community advisory panel for the Chief of Police in Boise, Idaho. We're in a group called Linked by Legacy with other nonprofits who have been established in people's memory to carry on their legacy. And we're also on the Mental Health Task Force for the United States Olympic and Paralympic Committee. As far as education goes, we really focus on mental health first aid, safe talk, QPR, know the signs, and help support Hope Squad. And we're really excited that the Lake Tahoe area is going to be piloting Hope Squad programming throughout many of the middle and high schools in the Lake area. So, mental health first aid, we're going to take a look at what some of the materials are, not all of it. But if you haven't taken mental health first aid, it is the help that's offered to a person developing a mental health problem or experiencing a mental health crisis. That first aid is given until appropriate treatment and support are received or until the crisis resolves. And so it is not learning how to identify and diagnose and treat mental health problems the same way that if you come across someone who is unresponsive, you check for pulse, you check for breathing, you might start applying CPR if you're trained in that until professional treatment is available, until the EMTs arrive and take over. Mental health first aid is training all of us to be able to do that same thing. So the action plan that we learn in mental health first aid is ALGE, assess for risk of suicide or harm, listen non-judgmentally, give reassurance and information, encourage appropriate professional help, as well as encourage self-help and other support strategies. And we know that we can apply this plan in any order, whatever is appropriate to whatever crisis is going on. So if that's something you're interested in, I recommend you take a mental health first aid training. So we are going to talk about substances. So co-occurrence, the reason that mental health and substance use or specifically this opioid module are combined is because substance use disorders can co-occur with any mental illness. And oftentimes it's hard to figure out what came first, the chicken or the egg. And they're often very intertwined. Some people are going to self-medicate with alcohol and other drugs. Some people with mood or anxiety disorders are 2 to 3 times more likely to have a substance use disorder. 2 pieces that you might want to take a look at. There is an article called The Life and Times of a Teenage Oxycodone Dealer. It's called The King of Boise. And Chief Bones from the Boise Police Department was the one who recommended our group take a look at this. It's also narrated and recorded. It's about an hour to listen to. So if you're into podcasting, it would be great to take a listen. It's really interesting to hear how a young teenager who was in school at the time was the one that was able to bring the substance into the community. And when he was, recognized and taken off of the street, that chain was cut off, and how the community had to shift to other methods to obtain this addiction. And it's not what you would expect. It's moms in Eagle, Idaho, where they were turned to using street drugs to fit this need. Another very interesting, very tragic story is out of Park City, Utah. Back in 2016, there were a couple boys, middle school boys, who died of an overdose from a substance called pink. And it's interesting to go back and look through those articles and see how it evolved and how the whole community really had to come together to address the issue. Opioids and pain management. So there's really a lot of different types of pain. We have physical pain, we have emotional and spiritual pain. Pain is on a scale. It's everything from acute to chronic. And starting in the 1990s, there really was a national focus in the United States on treating pain where there hadn't been before. Opioids were used to treat that chronic non-cancer pain. They were prescribed based on subjective reporting, and there really was a lack of focus on the risk of misuse. So with those three things put together, with a substance that is highly addictive, it's a explosion of problems. So since 1999, the amount of pain being reported remains stable, and yet the sale of opioids has increased over 400%. So between 2011 and 15, overdose deaths have tripled. And that means that about 90 individuals die in the United States every day. We are now more likely to die from opioids than a car accident. The primary cause of death is the respiratory depression. We stop breathing. And naloxone is a simple to administer overdose reversing drug. We're going to learn more about naloxone. So risk factors for overdose. You are more at risk to overdose if you're using multiple substances. If the variation in the strength and the content of the substance used is changing, so either the purity of the substance or the potency. Tolerance level, especially recent changes, can impact an overdose. So this could be a risk for populations maybe that have been away from the substance and are suddenly having access to it again. Maybe they've been incarcerated for a time and then they are released and they come into contact with the substance again. They might go back to using the same amount that they had used previously, not taking into account that their tolerance has decreased. Sometimes switching the method by which you are using the substance, maybe you're going from sniffing to eating or all the way to injection. And the way that we obtain the substance impacts how it is absorbed into the body, and that can be an overdose risk factor. People's physical health, how well their liver is functioning, if they've had weight loss. These are physical health conditions that can be a risk factor. Psychological health, sometimes if somebody is experiencing psychosis and they are using opioids, it can be a big contributing factor to an overdose. Being depressed, being really anxious, might increase using more substance than their body really can handle. Using a substance alone is a risk factor because, if you guys were in my class, why? Because nobody's there to observe the overdose. Nobody's there to intervene. Transient living, new dealers, new product, these are all risk factors. We've got drugs that are coming in from other areas that we just don't know anything about. Right now, fentanyl being contaminated into other products is a really big problem. And then thinking that you know everything, just having that ignorant, arrogant way of being means that you're not questioning any of these that could potentially contribute to an overdose. So what's the difference between being really high and a potential overdose? What are some of the signs and symptoms? Well, you might be really high if your muscles become relaxed and you've got really slow movements and reactions. But you are potentially having an overdose if you have a slow heartbeat, if you've got a really slow pulse, you've got pale, clammy skin, maybe your fingernails or your lips are turning blue, is potentially an overdose. If your speech is slow or slurred, that probably means you're really high. Symptoms of a potential overdose means there's deep snoring or gurgling. They call that a death rattle. Very infrequent or no breathing, overdose. Really high, sleepy looking, but they will respond to stimulation, yelling, a sternal rub, pinching. That's really high. They might be overdosing if it's just extreme sleepiness, the inability to awaken with a verbal or a physical stimulation. Again, one of the ones that you can do is a sternal rub, rubbing your knuckles in the center of the chest or rib cage very hard. That should produce a reaction. Symptoms of a person who are really high. It's a term called nodding. And I have not found the perfect video to share. And mental health first aid doesn't let you bring other things in. So if you're wondering what nodding looks like, I recommend you look it up on YouTube and kind of go through some of the different videos there. But I would say, you know, Google opioid nodding. It looks like complete euphoria. Overdose will be a very heavy nod, or they're not responsive to any stimulation. I was teaching this module. I was, you know, teaching mental health first aid and sharing it from the pulpit. And yet I wasn't carrying a Naloxone on me. I wasn't carrying Narcan. I didn't have any of the anti-opioid drugs with me. And yet I'm preaching to the choir. About a year and a half ago, 2 years ago, I had been out canvassing for a proposition throughout the north end of Boise. And I knocked on a door, and a gentleman answered it, and he was gone. He was there, and he was swaying, and we were kind of making eye contact, and he was nodding. And I recognized that he was really high, and he was not overdosing. But I realized that if he had been overdosing, I didn't have any Narcan on me. And if I had recognized this as I knocked on his door and was interacting about this, you know, petition I was asking him to sign, I could have handed it to him and said, you know, if you need this, it's here. If your friends need this, it's here. So it's important to know where it's at, how to have it, because you never know who you're going to come across. So Naloxone for overdose, it's going to temporarily reverse the opioid effects. It does require medical attention, even if it has a positive response. If you come across someone who is overdosing, you give them the Narcan, the Naloxone. If they have a positive response, meaning that they revive, it's for a short period of time, and they're still going to need the medical attention. That's what the positive response would be. It is safe to administer. You want to check your state's Good Samaritan laws to confirm what's covered. So let's do that really quickly. We're going to go to the Speedy Foundation's website. Go to thespeedyfoundation.org. And I'm going to show you guys how to get to this work. So we go to our work, and we go to educate. And then we're going to go to mental health first aid. Thinking. There it is. Down here at the very bottom. So I've got all kinds of resources that you would find in mental health first aid, but embedded in here is your opioid epidemic resources. We've got some from Idaho, and I still need to gather more from other states. But down here at the very bottom, we have liability protection. So as a first aider, you know, how are you covered? If I were to engage in someone and I see that they're very high and I offer them Narcan, you know, am I protected? Am I stepping outside my boundary? In Idaho and in Utah, we've got the Good Samaritan Act to say that I am covered. Immunity for calling 911 or seeking medical assistance. And then there's the Opioid Antagonist Act. So it specifies how it can be prescribed in certain circumstances. So like in Idaho, you don't need a prescription. You can go to the pharmacy and you can request it. And you just pay the copay of whatever your insurance covers, or you can pay cash. Or the Speedy Foundation has Narcan available that we can distribute to you through a grant from the Office of Drug Policy. Same in Utah. We've got Narcan available through Summit County. So I am still working to make sure that I am covered to mail the Narcan out. So after this training, there'll be some follow-up. I've got a request into the Board of Pharmacology in Idaho. So as soon as we get that clear, we'll be able to distribute through the mail. But if you've taken this training, so it can be used with anyone at risk. If you come across someone and they're not responsive, their heart's beating, they're breathing, you know, you're not going to perform CPR, you can try Narcan on them. Because if it's not Narcan, it's not going to do any harm. I've heard of people using Narcan to reverse an opioid overdose in an animal, in a dog that had gotten a hold of a fentanyl patch. So if you come across someone and you're like, I don't understand. Maybe it's a seizure that they've had and now they're laying here. Maybe, maybe it's a diabetic coma. You can try Narcan to rule out an opioid overdose, because not everyone who's going to overdose from opioids has taken them on purpose. They might have accidentally come into contact with them. So if naloxone is administered, you must call 911. You want to check for the signs of the overdose that we went over. You want to administer naloxone. And there's a lot of different kinds of naloxone. There is injectable, where you're going to get a syringe and a vial. There is an auto injector, kind of like an EpiPen. There's an assembly required nasal spray. And there's a ready to use nasal spray, Narcan. That's what we have available. I think that some of these are, upwards of $150, and some, are more like $15. Not every pharmacy has them in stock when you go. But if you do want a Narcan, ask for it. Ask your doctor to write a prescription so you don't forget. That way when you go to the pharmacy, they are filling it for you already. Anytime that an opioid is prescribed, they should by law be prescribing Narcan or any type of naloxone as well. You want to place the individual in the recovery position, and then you need to call 911. So we're going to watch a quick video from Narcan on how to administer.
Narcan nasal spray is an emergency treatment for a known or suspected opioid overdose. The appropriate use of Narcan nasal spray can help you save a life. Narcan nasal spray is not a substitute for emergency medical care. As with any drug, you need to be aware of important safety information concerning its use. If you encounter someone who is unresponsive and you suspect an overdose, first shake their shoulders and shout their name.
Kevin.
Ask if he or she is okay.
Hey, can you hear me?
Check for signs of an overdose. Unresponsive to touch or voice. Breathing is slow, uneven, or has stopped. Snoring, gasping, or gurgling sounds. Fingernails or lips are blue or purple. Administer Narcan nasal spray as quickly as possible if someone is unresponsive and an opioid overdose is suspected, even when in doubt, because prolonged respiratory depression may result in damage to the central nervous system or even death. Lay the person on their back to receive a dose of Narcan nasal spray. Remove Narcan nasal spray from the box. Peel back the tab with the circle to open it. Remove and review the printed quick start guide inside the package. Hold the Narcan nasal spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Do not press the plunger to test or prime the device. If you do, you will waste all or part of the dose of medication. Tilt the person's head back and provide support under the neck with your hand. Gently insert the tip of the nozzle into one nostril until your fingers on either side of the nozzle are against the person's nose. Press the plunger firmly to give the full dose of Narcan nasal spray. Remove the device from the nostril after giving the dose. After you have given this medication, seek emergency help right away. Narcan nasal spray is not a substitute for emergency medical care.
I'm with somebody who stopped breathing. I think they've had an overdose.
Move the person on their side after giving Narcan nasal spray. If possible, put their hands under their head and bend their upper leg forward. This helps prevent the person from rolling onto their stomach. This is known as the recovery position. Continue to watch the person closely. If they do not wake up or respond to your voice or touch, or if they do not seem to be breathing normally within 2 to 3 minutes, use a new Narcan nasal spray to give an additional dose in the other nostril.
All right. So that is how you administer Narcan. Perhaps you've taken CPR, and in that training, you're asked to call 911 before administering CPR. I would suggest probably doing the same, doing it in reverse steps here, just for the sake of getting help there even more quickly. So the Narcan kit comes with 2 different containers. So you'll have a backup if the first one does not work. Sometimes it takes many doses, and so that's why you want the paramedics to get there so that they can continue to administer Narcan. You'll hear EMTs talking about how it took 4 different doses of Narcan to get them revived and into the hospital. It does expire. The training that I was given from mental health first aid, there were instructors who said, if it's expired, who cares? It's still going to work. So if it's expired, maybe you need to get another dose to replace that dose. But if you come across someone, use it. Same thing if it gets too hot or gets too cold. Worst case, it's just not as potent as it should be. So we want to be careful of that. If you live in a very cold area, maybe wrap up the Narcan in bubble wrap. But at the end of the day, if you're concerned that somebody might be overdosing from opioids, give them a Narcan nasal spray, give them any type of naloxone that you have on hand. So we always want to assess for risk of suicide or harm. We're going through the allergy plan from mental health first aid. You want to be aware of your surroundings, be safe, be careful not to touch any drugs or needles. Be aware that although the individual might wake up immediately, they should still receive medical attention. So if you are both engaging in substance use, you will be immune from any type of, depending on your state, in Idaho, in Utah, you are immune from any type of repercussions legally for getting them help. You will be charged if you do not get them help, but you will not be charged if you do get them help for your opioid use. You want to be aware that the individual may not wish to be involved or not want to involve rescue or law enforcement. Especially in today's times, we can understand that there is a lot of discomfort in certain populations with law enforcement, and it can be scary. But at the same time, at this point, that is our system for helping, and we do need to get them help to save their life. We do want to strongly encourage professional help or peer assistance for somebody who is using opioids. Listening non-judgmentally. So this can be really hard, especially in families. So here are some statements that can really help take the judgment out of someone who is using opioids. I'm concerned about you. When one's tolerance is very low, one is at high risk for an overdose. Non-judgmental, informative, accurate. It takes a lot of work to take the emotion out of talking with someone who you care about. Do you have an overdose plan? Do you and your friends know about naloxone? So the gentleman whose door I knocked on, I hope that he had an overdose plan. I hope he was using with a friend so that if anything happened, somebody could step in. Unfortunately, I don't think that people think about it in those terms. Your safety is the most important thing. How can I help? If you feel the need to use the substance again, please don't do it alone. And I'm not an expert on this, but I could connect you with someone I trust who is, and they might be able to help. So those might be some statements that would be powerful for you to use if you have someone who is struggling with opioids or really any substance that is impacting your relationship in their life. Giving information, changing drinking and drug habits is not easy. Helping somebody understand that is powerful because we have been conditioned to think that it's a willpower issue, and it's not. Willpower and self-resolve are not always enough to stop the problem. Giving advice may not help the person change substance use habits. There's not many times in life where giving unsolicited advice has helped. You can often offer, I've noticed this, would you like some advice? And let them choose whether they would like to hear what your thoughts and path forward are. Not everyone wants abstinence as a goal. Reducing the quantity can be very worthwhile. And a person might stop using a substance more than once before they're finally able to stop entirely, and that's okay. Actions to not take when helping someone with a substance use disorder. We definitely don't want to join in with the person. We don't want to bribe, nag, or threaten. We don't want to make excuses for any behavior. And we really want to make sure that we don't take on the other person's responsibilities. We don't want to take on any guilt or feeling responsible. And understanding the stages of change, that it is a cycle, that they might fall out of this cycle. They might fall into relapse. It might take going through the cycle multiple times in order to make lasting change and come out. So encouraging professional help. So there's different types of professionals that can help with this. There's primary care physicians, psychiatrists, social workers, counselors, and other mental health professionals, and drug and alcohol specialists. They're out there in rural communities. They are hard to come by. Certified peer specialists. And I do appreciate how mental health first aid includes certified peer specialists in this because they're powerful. And if you're not familiar with it, again, put that into YouTube and just Google it. Certified peer specialists are a great way for somebody who's struggling to get care from someone else, and they are professionals. Types of professional help: there's talk therapies, there's medication, there's psychoeducation, and then there's other types of professional support. But professional help is out there. Sometimes helping someone get connected to professional care is incredibly supportive. But other support strategies. So mental health first aid has 2 E's in their action plan because self-help and other support strategies are just as important. There are support groups, there's family, friends, and faith networks. Avoiding friends and social situations that are involving alcohol and other drugs can be helpful. And some of the self-help groups, there's Alcoholics Anonymous and there's Narcotics Anonymous. So those are, again, things that you can check out. During this time of COVID, a lot of these local self-help support groups have gone virtual. And so if you have any questions, you're welcome to reach out, Shannon at thespeedyfoundation.org, and I'm always happy to connect. So there will be a link connected to this to request Narcan to be sent to you. We do ask for a donation to cover the cost of the shipping. And again, we've got those resources listed on our webpage, and just appreciate you guys taking the time to learn more about how to assist in an opioid overdose. That is all I have for you today. So thanks so much. Take care.